Lawrence.
Yes, yes, ma'am.
Good morning, Miss Lawrence.
Good morning, nurse.
I trust you have a good night's sleep.
Yes, nurse.
All right, Miss Lawrence. Can you tell me your first name?
Jennifer Lawrence, nurse.
Can you tell me your date of birth?
3rd of March, 1956.
Okay, Miss Lawrence, let me check your armband. I am just verifying that I'm checking the correct patient. Thank you, Miss Lawrence. My name is Nurse Dent, and I'll be your nursing assistant for today. First, what I'm going to be doing is I'm going to do a temperature check on you. It is a normal protocol to do a temperature check on every patient. After, I am going to do a glucose check on you, a skin assessment from head to toe. Is that okay with you, Miss Evan?
Yes, nurse. Yes, nurse.
Okay, I'll be right back. Let me give you a privacy curtain to maintain your privacy. I'll be right back. Ahead of time, I already sanitized my area, which I'm working. I also sanitize my equipment, wash my hands, place new gloves on. Now I am sanitizing, even though it's already sanitized, into my bin. Now I'm going to check this, make sure that Miss Lawrence's armpit is dry. Now I'm turning my machine on, place it under the arm. Can you close for me? Ahead of time, I already prepared her breakfast in case her glucose level is low. I already prepare her breakfast, and in case it become high, I prepare her medication also. All right, Miss Lawrence. Now I can hear machine. All right, maintain your privacy. Okay, Miss Lawrence, your temperature is 94.4, which is a good reading. No sign of fever. Okay. All right, let me record. 94.4 Fahrenheit. Okay, now I am going to prepare my lancet. Now I am placing my lancet into my device. Now I'm going to turn it up to expose my needle. Placing that the top on. Now my lancet device is ready. I'm also going to place a chip into my lancet device. And this device will tell you that your machine is ready. Turn on automatically. There you go. Now I am going to clean the finger. Now I am cleaning the finger to get rid of germs. I'm waiting to get it dry a little bit. I'm going to put the side, not the top of the finger. So you're going to feel a little pinch. Okay. What I'm going to do is I'm going to remove the first sign of blood. Now I'm going to not squeezing the finger, I'm just going to extract enough blood into my strip to do my reading. Can you squeeze for me? Okay. Now your glucose level is a bit high. It's now 20.4. So what I'm going to do, Miss Lawrence, is I'm going to apply your medication. So I applied our medication. Now I am going to remove my lancet device. I'm going to place it in my shop container. And I'm going to remove my strip. I'm going to place it in my regular garbage bin. Now I am going to wash my hands. Remove my gloves, wash my hands, and I'll be right back. Now I'll remove my gloves. into my bin. Now I wash my hands. Turn my pipe on. Put it in my hands. Now lather in my hands. I scrub the back of my hand and my fingers also. Probably do the same thing for the next hand. And I'm washing to my wrist. Now I'm going to scrub my hands. And meanwhile I'm cleaning the middle of my hands, I am also cleaning the top of my fingers. Same thing for the next one. And I'm washing my tongue. I'm cleaning my nails. Now I'm going to rinse bubble from my hands, making sure that all bubbles are gone. I am not going to touch the inner part of my wash stand, or I am not going to touch my pipe to get my hand contaminated. Now I dry my hand. Now take a towel, start drying my hand, trying to get rid of moss into my bin. Now I use a second piece of paper towel to turn the top of my pipe off. Now I am going to record my glucose finding. 20.4. Okay, now I'm going to place my gloves on. I'm going to do Miss Lawrence skin assessment. I am going to do a palpation. I'm going to check the color of the skin. I'm going to also check for edema. And zoom. Now I am going to do your skin assessment. I'm checking the head. I'm checking the hairline to see if there's any thinning of the hair. I am also checking for dry scalp, any lesions. Okay, everything looks perfectly normal. Wonderful. Now I am going to check the ears. I'm checking for dry scalp, chafing, cracking. Everything look beautiful. Can you check the next one? No sign of chafing. Now I am checking the skin. Nice and clear. I am also checking the eyes to see if there's any yellowness, jaundice, any dark line around the eyes, and there's not any. Now I am going to check your mouth. I'm going to use my flashlight to check inside the mouth. Miss Lawrence, can I open wide? Okay, I am checking. All teeth are intact. Gum nice and pink. No chafing, no swelling, no sign of gingivitis. Can you stick your tongue out a bit? Nice and pink. Thank you, Miss Evans. Beautiful. Now I am going to put back your mask on. If I was checking and there's any sign of gingivitis or swelling of the gum, I would recommend the dentist. And I also would do a further examination with my tongue depressor. Now I am going to check your neck. I'm checking the neck to see if there is chafing, any redness, any rash. Clean. I'm also checking the bony prominence to see if there is any sign of pressure. Okay, everything looks good. Right now, I'm going to check your arm. Checking the arms. I'm checking for temperature of the arm. I'm checking the elbow. I am looking for any dryness, any crack on the integrity of pushing up in bed. This can cause pressure wound, and this look perfectly fine. Now I am checking the hands. I'm looking for cyanosis, any deformation of arthritis in the fingers. Nail beds are nice and pink. Nice, beautiful. Thank you, Miss Lawrence. Now, to maintain your privacy, what I'll do, checking this area out, look under the breast to see if there's any redness, any chafing, because this is area that kept sweat, so it can cause fungus and cause infection. I also would be checking your tummy, hard or soft area. Is there any pain in this area, Mr. Lawrence?
No.
Nice. I'm checking for warmness or coolness. Beautiful. Now I am going to check your back. Now I am checking in the back of the neck. I'm checking going down the spine. I'm checking the bone primary to see if there's any sign of redness, any dark area, any pressure. I am now checking. This is one area that can cause pressure, the cecal cactus. There is no sign of redness. Everything looks beautiful and clean. Now, Miss Evans, let me maintain your privacy. Turn it back here. What we look for in the back is sign of pressure that can cause from wound extradite, perspiration, or incontinence. Now I am going to move on to your feet, your leg and your feet. Now I am going to check your legs and your feet. I'm just going to expose your knees. Okay, now I am checking the knees to see if there's any wound. I am checking for the temperature of both feet. Both feet are the same temperature. I'm checking for the discoloration on the feet, any mold, any wart. I am checking your ankle. I'm checking your feet. I'm checking to see if there's any sign of edema to the ankle or the foot. I am checking in between the toes. Nice and clean. Toes fine. Toes nice. Okay. Checking. Now what I'm going to do, I'm going to use my glass to check the heel of the foot in this area, because of the foot lying in bed for hours on your back. That's one area that can become pressured, so it can develop pressure also. Now I'm checking the bottom of your feet. Meanwhile, I'm giving you a massage. Can you feel this, Miss Lawrence?
Yes, ma'am.
This is one area that pushed towards the footboard, so it could cause pressure to that area. I'm doing the same thing here. Can you feel, Miss Lawrence?
Yes, ma'am.
Okay, nice. So your foot is okay. Now I am going to maintain privacy by cover up your feet. Okay, now Miss Evans, Miss Lawrence, I am going to wash my hands and I'll be right back.
Okay.
Miss Lawrence,
Yes,
I am finished doing your skin examination.
Yes, ma'am.
Is there anything that I can get for you?
It's okay, ma'am.
Alright, here is your call light, Miss Lawrence. Is there anything that you need? I'll be right outside. Thank you.
Okay, nice.
This was a presentation by Karen Dent and Jennifer Lawrence, and blood glucose check-in and skin assessment. Thank you.